Hey, it's Dr. Angelina with SurgiCare Arts Aesthetics Institute and Georgia SurgiCare. Today we will discuss potential surgeries that may be required after bariatric surgery and weight loss surgery. A huge population of patients who require to have the surgery in order to lose the weight, because again, as we know, weight loss is a chronic problem. But you don't hear as much talk and conversations about what happens after. What happens after you lose the weight? The thing is, the weight loss surgery is just the beginning of the journey. It continues throughout your life. It's a lot of times not the last surgery you're gonna get, because once you lose the weight and you feel great about yourself, that your health is better, your diabetes is gone, your hypertension is better, you can walk, you can run. A lot of people bring up the part where they have better sexual activity. There's so much positives about weight loss surgery, but a lot of people struggle with their body image because now I have saggy skin potentially, or more saggy skin, stretch marks, and deflated breast, and many other things that make people feel not their best. Does it happen to everyone? No, there's plenty of people who lose a great amount of weight and don't require further surgery for body contouring and skin removal, but a lot of people do. What are the most common surgery that we usually talk about? And again, it will vary per person. One person may need arm lift, so that's when we take out extra skin on the arm here, and other people will be fine because maybe that's not where they carry their excess weight. Breast lift or breast reduction, so again, varies. Some people have large breasts, it doesn't matter what size they were before, so they may require breast reduction, and other people will deflate and lose a lot of fat in their breast and will require breast lift, sometimes with implants. It does not only work like that for women. Men may have to have breast reduction or skin reduction on their chest. Next area, tummy, right? Tummy tucks, very common. In women, we have to a lot of times put the muscles back together, do muscle repair between the rectus abdominis muscle. So your six-pack muscle gets separated. We can do our best to get our six-pack back and work out as much as we can, but even with that, not everybody will put their muscles back together. People may require back lifts, so the excess skin on the back, it will bring the butt up, it will bring some of the lateral, so the sides of the thighs up as well. Bra lift or upper back lift, where we take off extra skin on kind of that bra line, so that skin that goes above and below it and creates that fold right underneath the bra line, that can be brought up, and that scar hides very well in the bra. Thigh lift, that's also a difficult one to tolerate for a lot of people, more just from mental standpoint. They want to have thinner skin, thinner thighs. Some people will talk about the gap between the legs. But if there's a lot of extra skin, the more weight you lose, it gets very crinkly, it gets very loose, and the inner thigh skin is very thin. And compared to other tissues on the outer thighs, for example, that just overall that skin has different texture, and it will have that crepey, saggy look much quicker than anywhere else in the body. And removing that skin potentially could be another surgery. Some people may choose to just have liposuction procedures for body contouring. Maybe the skin was not that stretched out or was able to retain a lot of elasticity and shrink back, but they may require some of the procedures to contour the body to make sure the leftover little stubborn pockets of fat are removed, and that's where liposuction, in my practice, I will add Vaser and Body Tight at the same time to still continue to shrink skin as much as we can. And there are a few others, we can do stuff to the face. If there is excess skin on the neck, the potentially needed neck or facelift. And again, some people will qualify for non-invasive face tightening, neck tightening. A lot of variations for a lot of people, but those are the most common things that potentially can be done. Also, common question, can we do it all at the same time? And I know there are some surgeons who do those marathon surgeries and do everything at the same time, or at least a lot of things at the same time. For me, I do try to minimize to 4 to 5 hours in surgery if at all possible for safety reasons. We know from the studies that more than 6 hours on the table under general anesthesia can increase risk of other complications such as blood clots or healing. And so if we do longer surgeries on anybody, I will need absolute clean bill of health and make sure that we understand the risks, make sure we get up and walk around after surgery, basically day one, day zero, to prevent any potential complications. If you have any questions, you can always come to me. We can do a whole body assessment, make a plan. It could be a like 2-3 year plan if we have to, and address all those issues one at a time, two at a time, just depends on what we're doing. Get your evaluations before you do bariatric surgery. That's something that I do for a lot of my patients, since we are a bariatric surgery center as well. And so patients who will undergo bariatric surgery with my partners, a lot of times will come and see me prior to that surgery or in the very beginning stages of their bariatric journey. So we can kind of guesstimate, okay, based on your current body type, I think this skin will need to go away when you actually get to your goal weight or close to your goal weight. So we can kind of plan. We'll reevaluate again once you're getting closer to your goal weight and adjust those plans as needed, but at least gives you some idea what can be done for your body type.